The objectives for this session are: describe the importance of antibiotic stewardship, define antibiotic stewardship, discuss the nursing role in antibiotic stewardship, and review essential steps in interdisciplinary communication when advocating for antibiotic stewardship. Within 10 years of the breakthrough development of penicillin, antibiotic resistance was reported. According to the Center for Disease Control and Prevention, each year 2 million cases of antibiotic-resistant bacteria are reported, and they result in approximately 23,000 deaths in the United States. What is the definition of antibiotic stewardship? The definition is coordinated interventions designed to improve and measure the appropriate use of antibiotic agents by promoting the selection of the optimal antibiotic drug regimen, including dosing, duration of therapy, and route of administration. According to the CDC, the single most modifiable factor leading to the development of antibiotic resistance is the overuse and misuse of antibiotics. Some goals are to reduce the development of antibiotic resistance and improve patient outcomes. The role of the nurse in antibiotic stewardship is to obtain appropriate cultures before antibiotics are started, use microbiology results to help guide the optimal selection of antibiotics and guide decisions to stop therapy in cases where culture results represent colonization rather than infection, help inform decisions to start antibiotics promptly at the early signs of likely bacterial infections, prompt and participate in discussions about antimicrobial usage, including antibiotic de-escalation, and take a more detailed allergy history. A common misperception among nurses is that antibiotic stewardship is a problem to be addressed by providing prescribers or pharmacists. Because antibiotic stewardship affects all venues of patient care, nurses across the healthcare continuum have an opportunity to play an important role in antibiotic stewardship. These essential interventions include identifying the use of broad-spectrum antibiotics, identifying opportunities for switching from oral to intravenous antibiotics, monitoring and identifying adverse events, assuring cultures are obtained prior to starting antibiotics, providing appropriate discharge instructions and follow-up, and providing patient education. As a quote taken from the Allied Journal for Infection Control, nurses are antibiotic first responders, central communicators, coordinators of care, and as well as being 24-hour monitors of patient status, safety, and the response of antibiotics. Concepts to pay particular attention to in this video are understanding the importance of culture and sensitivity tests, importance of knowledge of antibiotics, including indications for prescribing antibiotics, adverse reactions, dose of medication, duration of treatment, and appropriate route of administration. In addition, you will note key communication techniques to enhance interdisciplinary communication about antibiotic stewardship. As we will see in the upcoming clip, the nurse is the last line of defense for the patient regarding antibiotic use and misuse.
All right, Chloe. Hello.
Hi.
So day number 5 today, huh?
Yes.
How are you feeling today?
I'm feeling a lot better. My chest doesn't hurt as much, and
Yeah.
I feel like I'm getting a lot of the gunk out.
Good. That's good. And I see you're still on the antibiotic, which I just hung about 30 minutes ago.
Mm-hmm.
So you're still running on the ceftriaxone, and that's to help decrease with those fluid buildup in the alveoli. So I'm going to take a listen to your chest. How's it feeling?
It's feeling okay. I mean, it's not perfect. But
Okay. You want to take a nice deep breath in for me? One more deep breath in. I have you come forward for me. I'll take one more listen to the back end, please. Good. Good. Awesome. Your lungs sound great, Chloe.
Awesome.
And you've been continuing with the IS as prescribed?
Yep.
Awesome.
How's it going?
Say hi.
It's been going. I'm ready to get out of here.
Ready to get out of here?
Yeah.
Yeah, so Chloe's been here day 5 now, running on the ceftriaxone, and her stats have been good, stabilizing in the 96, 97 range, which she came in far lower than that, around the 88 range, and so she was weaned recently, just this past evening. She was at 4 liters of oxygen, and we weaned her down to 2.
Okay.
So that's looking good. Her lung sounds are clear. She's been using the IS, how would you rate your chest pain as of right now?
Right now I'd probably say like around like a 2 or a 3.
Oh, that's good. Before when you came in, it was at an 8.
Yes.
So she's been good there too.
Everything sounded pretty good. You ready to go home?
Yes. Oh my gosh.
Oh, I bet. Yeah, so I guess my question for you, Dr. Johnson, is what would you like to do with the antibiotic, being that she's starting to stabilize with the SATs and the oxygen?
Yeah, I'm thinking we're just going to continue as is and finish up your antibiotics and then hopefully get some discharge orders ready for you and get you home.
That'd be awesome.
Any more questions for me?
I don't think so.
All right, sounds good. I'll get those working right now. You take care.
Great, thanks.
All right, thanks, Dr. Johnson. All right, so it looks like we're gonna keep running the ceftriaxone. Can I watch you do the IS for me before I?
Yeah.
Okay.
As we just saw, Sarah questioned Dr. Johnson about Chloe's duration of IV antibiotic therapy, but failed to further advocate for a different course of treatment. Sarah's report and questions for the provider were appropriate. However, the desired patient outcome, discharge on oral antibiotics, was not met. In the next scene, the nurse will demonstrate additional communication strategies to engage the provider.
Hey, Dr. Johnson.
Hey.
Hi. Do you have time to meet about 4:14 for a little bit?
Yeah,
Just talk.
I got a quick second.
Okay, awesome. So I'm wondering, because since she's day number 5 now on that ceftriaxone, her cultures have came back negative. Her lungs are clear. She's been using the IS as prescribed, and her SATs are also in like the 97, 98 range. So I'm wondering if you want to stick with the plan of the IV ceftriaxone.
Yeah, just follow those orders I put in and everything should be good.
Okay. Sounds good. Thanks.
Again, Sarah did a great job with reporting the patient data to the provider with the rationale for antibiotic therapy change and continuing the conversation outside of the patient room. However, she again unsuccessfully did not fully advocate for the patient and fulfill her role as a promoter of antibiotic stewardship. In the final scene, the nurse incorporates feedback from each of the previous encounters to successfully advocate for an appropriate antibiotic prescription.
Oh, Dr. Johnson, can
Yeah.
I run something by you quick?
Yep.
About 4:14? Okay, so she's on that IV ceftriaxone now, day number 5 on that treatment. And since we're looking at discharge with her, her cultures came back negative, her lungs are clear, she's been using the IS as prescribed, her SATs are 97, 98. And since she's going to be discharged soon, do you think we should switch now to an oral antibiotic?
Oral antibiotic? Yeah, I can definitely put that in for.
Okay, good. You think that's a smart move then?
Yep. I can do that for
right.
discharge. Anything else needed?
Perfect. No, I don't think that. I think so.
Thanks.
In this last example, Sarah fulfilled her role as a patient advocate and supporter of antibiotic stewardship. She was able to appropriately address antibiotic therapy, objectively state patient data to the provider, ultimately improved patient outcomes, and anticipated discharge by discussing antibiotic therapy changes from IV to oral. From these example scenarios, we can see how essential it is for nurses to understand, advocate, and engage in these conversations with providers. Nursing's perspective and active participation of nurses and the nursing profession are crucial to the optimal success of antibiotic stewardship programs. Nurses are in the hospital, in the home, and in the community. As such, they can be educators, advocates, and ambassadors for widespread behavioral change to more vigilant antibiotic awareness in our society.